नमस्ते। आज म यहाँहरूको सामने नेसनल लेप्रोसी स्ट्राटेजी 2021 देखि 2025 लिएर उपस्थित भएको छु। गभर्नमेन्ट अफ नेपाल, मिनिस्ट्री अफ हेल्थ एन्ड पपुलेसन, डिपार्टमेन्ट अफ हेल्थ सर्भिस, एपिडेमियोलोजी एन्ड डिजिज कन्ट्रोल डिभिजन, लेप्रोसी कन्ट्रोल एन्ड डिसेबिलिटी म्यानेजमेन्ट सेक्सन, टेको, काठमाडौँ, नेपाल। यो चाहिँ लेटेस्ट नेसनल लेप्रोसी स्ट्राटेजी रहेको छ, जुन चाहिँ 2021 देखि 2025 सम्म रहेको छ। मैले यो कुराहरू चाहिँ शुभकामना सन्देश चाहिँ छोड्न गइरहेको छु, किन भन्दाखेरि भिडियो एकदमै लामो हुन्छ। मन्तव्यलाई पनि मैले यही नै छोडिरहेको छु। टेबल अफ कन्टेन्ट रहेको छ, एब्रिभिएसन एन्ड एक्रोनिम्स, एक्जिक्युटिभ समरी, इन्ट्रोडक्सनमा माइलस्टोन अफ नेसनल लेप्रोसी कन्ट्रोल प्रोग्राम इन नेपाल, नेसनल लेप्रोसी कन्ट्रोल प्रोग्राम, करेन्ट लेप्रोसी सिचुएसन, इन डेप्थ रिभ्यू अफ नेसनल लेप्रोसी प्रोग्राम एन्ड इन्भिजनिङ रोड म्याप टुवार्ड जेरो लेप्रोसी। 2 नम्बरमा रहेको छ नेसनल लेप्रोसी स्ट्राटेजी 2021 to 25, vision, goal, target, objective, strategic pillar, strategic research agenda, stratification, strategic objective as per the burden, role and responsibility of different level. 3 नम्बर रहेको छ monitoring and evaluation. 4 नम्बरमा रहेको छ नेसनल लेप्रोसी एक्सन प्लान अफ नेपाल 2021 to 25. एब्रिभिएसन र एक्रोनिम्सलाई मैले यही छोडिरहेको छु। एक्जिक्युटिभ समरी, नेपाल declared elimination of leprosy as a public health problem at a national level in 2010. 2010 मा चाहिँ नेपाललाई के गरिएको थियो त, elimination of leprosy is a public health problem को गरिएको थियो। The national leprosy program is committed to achieve sub-national level elimination. र अहिलेको चाहिँ मेजर गोल भनेको नै elimination at a sub-national level रहेको छ। During fiscal year 2020-21, a total 2,173 new leprosy cases were detected and put under MDT. The registered prevalence rate was 0.73 per 10,000 population. There were 95 new cases grade 2 disability at the time of diagnosis, out of which one was a child under 15 years of age. Similarly, 101 new child cases and 795 new female cases were recorded in the same period. Province 2 reported the highest number of new cases, whereas Kandaki province reported lowest number of cases. There are still 2 provinces and 11 districts whose prevalence rate is above 1 per 10,000 population. 2 provinces and 11 districts whose prevalence rate is above 1 case per 10,000 population. The previous national leprosy strategy focused in eliminating leprosy as a public health problem at sub-national level and sustaining quality leprosy services, including social inclusion of people affected by leprosy. Epidemiology and Disease Control Division, Leprosy Control and Disability Management Section, with the support from WHO, GPZL and other international and local partner, conducted an in-depth review of national leprosy program and envisioning roadmap to zero leprosy in 2019. The review revealed strength, challenge, limitation, gap of national program. Review showed that not all national leprosy strategy was implemented and its objective target were not fully attained. A national roadmap for zero leprosy was developed with the vision of leprosy-free Nepal and a goal of elimination leprosy at the sub-national municipality level. To materialize and achieve the target and milestone of the roadmap, National Leprosy Strategy 2021 to 25 has been developed in 2021. The National Leprosy Strategy 2021 to 25 will specifically address stopping transmission of leprosy by strengthening case detection and contact tracing activities, The district and municipality are grouped as a high burden, moderate burden, and low burden based on various leprosy indicators. The identified district municipality will prepare a specific implementation plan to consider the agreed national strategic plan, prepare a specific implementation plan to consider the agreed national strategic plan. For the strategic objective to be achieved, following key areas are given due to attention. A. To strengthen the service delivery and referral system. B. To strengthen the health system that supports service delivery, including capacity building of peripheral staff and teleconsultation. C. To promote community participation. And D. Innovation. National Leprosy Strategy in 2021 to 25 will guide the government, partner, and all stakeholders, including people affected by leprosy, to move the country forward towards a leprosy-free Nepal. Introduction. Leprosy is an infectious disease caused by the microbacterium leprae and acid-fast rose-shaped bacillus. It is also called Hansen disease. It is transmitted by droplet from the nose, mouth, and sometimes through close contact with untreated leprosy patient. The disease mainly affects skin and the peripheral nerve. It is curable, and prompt and complete treatment in the early stage can prevent disability. Milestone of National Leprosy Control Program in Nepal. Milestone of the National Leprosy Control Program in 1960. Leprosy survey conducted by Government of Nepal in collaboration with WHO. In 1966, launched Dapsone monotherapy. In 1982, introduction of MDT. In 1987, integration of vertical leprosy control program into general basic health services. In 1991, leprosy elimination goal was set. In 1995, focal person TB and leprosy assistant appointed for district and region. In 1996, independent evaluation of leprosy control program. All 75 districts were brought under MDT. Okay. In 1999, 2000 and 2001 to 2002, two rounds of national leprosy elimination campaign implemented. 2008, intensive effort made for achieving elimination at national level. In 2009 and 10, leprosy elimination achieved and declared at national level. 2011, National Leprosy Strategy 2011 to 15 prepared, and 2012-13 National Guideline 2013-2070 revised. 2030, Nepal signed on Bangkok Declaration toward a leprosy-free world. 2013-14 midterm evaluation of implementation of National Leprosy Strategy 2011 to 2015. 2017 National Leprosy Strategy 2016 to 20. National Leprosy Operational Guideline revised. 2019 in-depth review of National Leprosy Control Program and envisioning towards zero leprosy. 2021 National Roadmap for Zero Leprosy Nepal 2021 to 2030. National Leprosy Strategy and Action Plan developed and implemented. National Leprosy Control Program. Ministry of Health and Population is responsible for the overall planning, policy formulation, organization, coordination of health service at the national, province, and local level in Nepal. The Department of Health Service is one of the three divisions of MOSP, which is responsible for preventive, promotive, curative health services. Leprosy Control and Disability Management section under the Epidemiology and Disease Control Division is the responsible section for the National Leprosy Control Program in Nepal. Leprosy services are a part of basic health service in Nepal. Current leprosy situation. Following the continuous effort from the Leprosy Control Program, MOSP, and the support from WHO and other partners, leprosy was declared eliminated as a public health problem at national level in 2010. In fiscal year 2077-78, that is 2020-21, the registered prevalence remained below the elimination threshold, with the national registered prevalence rate of 0.73 out of 77 districts. 11 districts reported prevalence rate more than 1, while 75 districts reported prevalence rate less than 1 and 11 districts reported 0 cases. Here we can see the prevalence rate of leprosy cases reported at district level in fiscal year 77-78. Province-wise prevalence, we can see the national prevalence is 0.73 per 10,000 population. In-depth review of National Leprosy Program and envisioning roadmap toward zero leprosy. An in-depth review of National Leprosy Program was carried out between 7th and 17th July 2019. It was conducted by LCTMS, EDCT and in close collaboration with WHO Nepal, Global Partnership for Zero Leprosy, International Federation of Anti-Leprosy Association, partners Nepal and persons affected by leprosy. The objective of the review were to make an independent, comprehensive and in-depth analysis of current leprosy situation, leprosy elimination effort in the new federalized context, to provide expert advice and sound recommendation for strengthening leprosy services, to envision a roadmap to reach zero leprosy in Nepal. Okay, I am going to skip this. The main recommendation from review. What are the main recommendation? High level advocacy to strengthen ownership at provincial and municipal level, improve surveillance system, intensify active case finding, implement information, education, communication activity for raising community awareness and reduction of stigma, ensure contact screening and cover contact with chemoprophylaxis, train all health staff on leprosy and increase number of technically qualified staff, ensure adequate allocation and distribution of fund according to the disease burden at local level, explore partnership for complementary funding, strengthen supply chain management to ensure uninterrupted supply of medicine and appliances for disability care, expand access and coverage of comprehensive disability care in public facility and NGO run institute, active engagement of persons affected by leprosy in planning and implementation of leprosy program. Based on the recommendation of in-depth review, National Roadmap for Zero Leprosy 2021-30 has been developed in the goal of leprosy-free Nepal. The milestones for zero leprosy are mentioned in Annex 1. The National Leprosy Strategy and Action Plan 2021-25 has been developing, aligning with the National Roadmap for Zero Leprosy. This strategy has incorporated objectives such as improving clinical case management, along with referral, addressing the issue regarding management of cross-border cases through coordination and promoting research and innovation. In addition to previous strategy, 4-pillar strategy has been proposed in a new strategy adding scale of leprosy prevention alongside integrated active case reduction pillars in previous strategy. Targets such as achieving zero new child autocanthonous cases at all municipality, reducing number of cases to zero in targeted municipality, decrease new child leprosy case detection rate per million child population, increase coverage of preventive chemoprophylaxis among eligible contact, increase household contact examination of an index case with aided in new strategy. The criteria for stratification of district and the local level has been identified and more composite stratification criteria has been proposed. Targeted intervention based on the level of burden has been proposed. National Leprosy Strategy 2021-2025. The National Leprosy Strategy 2021-25 highly consider the previous National Leprosy Strategy 2016-20, finding and recommendation from the in-depth review of National Leprosy Program 2019, the National Roadmap for Zero Leprosy Nepal 2021-30, as well as different health policy and plan of Nepal. It also considers the World Health Organization Global Guidance on Towards Zero Leprosy, Global Leprosy Hansen Disease Strategy 2021-2030. Vision: Leprosy-free Nepal. Goal: elimination of leprosy, interruption of transmission of leprosy at the sub-national level, municipality level. Interruption of transmission is defined as zero new autocanthonous child leprosy cases for consecutive 5 years at the municipality level. Target 1. Mapping of district municipality including human resources 2019 updated 25. Target 2. Number of municipality with 0 new child autochthonous cases over consecutive 5-year period from 605/753 to 700 to 753. Target 3. Number of municipality with 0 leprosy cases 65 to 377 in 2025. Target 4. Number of annual new leprosy cases reduced to 3,282 to 2,462, 25% reduction from baseline. Target 5. Rate of new leprosy cases with grade 2 disability per million population 5.32, less than 1. Target 6. New child leprosy case detection rate per million child population 32, less than 6. Target 7. Number of child cases among new leprosy cases reduced to 2060. 7.9% child cases proportion among new leprosy cases to 52% child proportion among new leprosy cases. Target 8. Number of child grade 2 disability among new child leprosy cases 2 of 260 new child cases to 0. Target 9. Discriminatory law. Discriminatory law exists. Zero discrimination as a result of no discriminatory law and compliant reporting system in place. Target 10. Rollout of preventive chemoprophylaxis 50% coverage among eligible contact. Target 11. Household contact examination of an index case within 3 months of case detection 75% of index case. 2019 is taken as a baseline because of impact of COVID-19 pandemic on leprosy case diagnosis and treatment. For baseline, only 1 year data of 2019 is taken due to unavailability of municipality level data of past 5 years. Objective: to eliminate leprosy at the subnational level, province, district, local level, to strengthen clinical case management at district and municipality level and improve referral system in 2 number. At 3 number, to enhance capacity building through training of health staff, particularly in the peripheral health facility. 4. To enhance prevention of leprosy. 5. Reduction of stigma and discrimination. 6. To strengthen leprosy surveillance system and regular monitoring, supervision and periodic evaluation at all levels. 7. To strengthen partnership among different stakeholders. 8. To strengthen management of leprosy complication like reaction and disability prevention and rehabilitation. 9. To coordinate with neighboring state of India in management, reporting and referral of cases from border area. 10. To prompt research and innovation. Strategic pillar. Pillar 1. Implementation of national leprosy roadmaps for zero leprosy across all level, national, province and local. Pillar 2. Scale of leprosy prevention alongside integrated active case detection. Pillar 3. Manage leprosy and its complication and prevent new disability. 4. Combat stigma and ensure human rights are respected. Key component of the strategic pillar. Strategic pillar 1. Implement the national leprosy roadmaps for zero leprosy across all level, nation, province and local. Political commitment with adequate resources for leprosy elimination at all levels in an integrated approach. National partnership for zero leprosy and zero leprosy roadmap engaging all stakeholders. Capacity building in the healthcare system for quality services. Improve program management, surveillance and monitoring and evaluation system. Promote operational research. Pillar 2. Scale of leprosy prevention alongside integrated active case detection. Active contact tracing for all cases, especially household contact. Preventive chemotherapy scale up through chemoprophylaxis. Integrated active case finding in integrated endemic hotspot population. Pillar 3. Manage leprosy and its complication and prevent new disability. Early case detection, accurate diagnosis and prompt treatment is a key component. Access to comprehensive well-organized referral facility. Early diagnosis and management of leprosy reaction, neuritis and disability by improving capacity through training. monitoring, support, and training in self-care, mental well-being through psychological first aid and therapeutic counseling, monitoring of antimicrobial resistance, adverse drug reaction, and adverse drug event. Pillar 4. Combat stigma and ensure human rights are respected. Adoption of principle and guideline for elimination of discrimination against persons affected by leprosy and their family member. Inclusion of organization and network of persons affected by leprosy at all levels. Abolishment of discriminatory law. Develop system to monitor stigma, reduction in communities and villages and cities, access to social support and rehabilitation with coordination with government agency and NGO. Strategic research agenda. What are the strategic research agenda? The National Leprosy Control Program will participate and join research institution partners to work on the following research areas, but not limited to: 1. Early diagnostic tests for disease and infection. 2. Improve understanding of transmission, including host, agent, and environmental factor and zoonotic transmission. 3. Improve understanding of mechanism of leprosy reaction. 4. Optimize case detection through integration, especially in low endemic setting. 5. More effective drug or drug combination or shorter regimen to treat leprosy and leprosy reaction. Alternative drug regimen using more effective bacterial drug. Other immunosuppressant for leprosy reaction. Improve preventive approach using chemotherapy regimen. Effective model of care throughout the patient journey. Digital health application in leprosy, like digital technology for referral of suspect to improve case detection and platform to communicate between health worker and patient. Inclusive approaches in community-based rehabilitation and stigma reduction. Operational understanding of defaulting or poor compliance, in-depth interview with the defaulter cases and problem identification. Teleconsultation. Incidence of rifampicin resistant leprosy. Optimize case detection, monitoring and evaluation and training through integration, especially in low endemic setting. Participation of people affected by leprosy in leprosy services. Stratification. Program indicator. New case detection is absolute number, reference period 2017 to 2019. Profile characteristic of new cases, reference period 2017 to 2019. Stratification criteria. District. Intensified high burden. New case detection rate more than 10 per lakh population, or new case detected, new cases 51 and above, or profile characteristic of new cases any two from criteria C. Accelerated moderate burden. New case detection rate 5 to 10 per lakh population, or new case detected, new case 21 to 50, or profile characteristic of new cases any one from the criteria C. Sustained low burden. New case detection rate less than 5 per lakh population, or new case detected, new cases 1 to 20, or profile characteristic of new cases none from criteria C. Reported data of 3 last year. Any district that has reported detected the targeted NCTR in last 3 years. Any district that has reported detected the target number of new cases in last 3 years. Profile characteristic of new cases in last year. First, proportion of children under 15 years among new cases more than 10%. Reported grade 2 disability in child new cases. Proportion of new cases with grade 2 disability more than 5%. Local municipalities. Intensified high burden. New cases detection rate more than 10 per 10,000 or 1 lakh population, or profile characteristic of new cases any two from criteria C. Accelerated moderate burden. New case detection rate 5 to 10 per lakh population, or profile characteristic of new cases any one from criteria C. Sustained low burden. New cases detection rate, profile characteristic new cases less than 5 per lakh population, or none from the criteria C. Strategic objective is for the burden. Sustain continuing effort for low burden district or local level, providing simplified guideline and material for diagnosis and treatment at each health facility level. Ensure easy and uninterrupted access to free MDT drug. Continue integrated leprosy surveillance system. Increase coverage of household contact examination. Ensure community awareness and IEC activities. Ensure at least one health worker trained for leprosy in its health facilities. identify focal area where the disease is prevalent and implement core activity of the intensified strategy, improve referral system for lower level service to suspect or recognize leprosy sign and symptom and refer accordingly. Accelerated step of effort for medium burden district or local level, providing simplified guidelines and material for diagnosis and treatment at each health facility level, ensure easy and uninterrupted access to free MDT drug, continue integrated leprosy surveillance system, increase coverage of household contact examination, ensure community awareness and IEC activities, plus ensure all health workers trained for leprosy in each health facility to integrate intervention on prevention of impairment and disability and rehabilitation. Early leprosy case detection through integrated skin camp each year. Identify at least one site for silt skin smear in the district local level. Inclusion of major private sector for leprosy service, example medical colleges. Identify at least one site in the district for referral of complication management. Intensified special effort for high burden district or local level, providing simplified guideline and material for diagnosis and treatment at each health facility level. Ensure easy and uninterrupted access to free MDT drug, continued integrated leprosy surveillance system, increase coverage of household contact examination, ensure community awareness and IEC activity, ensure all health workers trained for leprosy in each health facility, identify at least one site for skin smear in the district local level, inclusion of major private sector for leprosy services, example medical colleges. Identify at least one site in district for referral of complication management, plus early leprosy case detection through house-to-house screening to strengthen intervention on prevention of impairment and disability and rehabilitation, to improve close monitoring, supervision and evaluation toward elimination, prioritization of operational research. Strategic objective is for the burden. For the strategic objective to be achieved, the following key area must be given due attention and focus. Access to transform and strengthen the service delivery and referral system. People and system, strengthen health system that support service delivery, including capacity building of peripheral staff and drug record management system monitoring and evaluation. Community involvement, promoting increased community participation and program ownership. Innovation, mathematical modeling, GPS mapping, other referral system model, electronic database and reporting e-learning. Inclusion, strengthening participation of people affected by leprosy in leprosy services. Preventive therapy, leprosy chemoprophylaxis, focus or blanket approach. Integration of TB, leprosy, PKDL in active case detection. Attention to special population and hard to reach area. Role and responsibility of different level. National level, province, district level and local level. At national level, develop national strategy, guideline and action plan as per necessary. Program planning and budgeting. Provide technical assistance to province. Conduct periodic review and strength monitoring and evaluation system. Capacity building of national and province staff. Strengthening national leprosy surveillance system. MDT and other logistic management. Advocacy and awareness. Strengthen and sustain partnership and coordination at national level. Promote research. Province, district level, coordination and implementation. Program planning and budgeting. Provide technical assistance to the local level. Conduct periodic review and regular monitoring and supervision. Capacity building of provincial, district and local level staff. Ensure proper recording and reporting of leprosy data from local level. Ensure MDT and other logistic supply management and proper distribution. Advocacy and awareness. Strengthen and sustain partnership and coordination at the province level. Provide support and coordination for implementation of research. Local level, leprosy case detection and management, contact tracing and contact examination, chemoprophylaxis, loss to follow-up, retrieval, program planning and budgeting, support to local level facility and monitoring, conduct periodic review and regular monitoring and supervision, capacity building of local health worker and FCSB, advocacy at local level, ensure proper recording and reporting of leprosy data from health facility, ensure timely request of MDT drug and other logistic to prevent major stock out, community awareness, strengthening community involvement, provide support and coordination for implementation of research, monitoring and evaluation. National Leprosy Control Program will be responsible to monitor and evaluate the progress of implementation of National Leprosy Strategy. Nepal 2021 to 25. Periodic review, monitoring and assessment will be done, and corrective measure and adjustment will be implemented as necessary by the national program in close collaboration with the National Leprosy Technical Committee, WHO Leprosy Partner and Organization for persons affected by leprosy. Monitoring would be based on the target set in National Leprosy Roadmap and this National Leprosy Strategy 2021 to 25. At its level, the health structure, particularly at the provincial, district and local level, a specific monitoring function will be instituted. Noting the objective based on endemicity. The midterm evaluation will be held in 2023 and final evaluation will be held in 2025 respectively as a part of National Leprosy Strategy 2021 to 25, where technical and funding partner and other stakeholders at national, provincial and district and local level will be participating to assess progress and accomplishment of the strategy and subsequently do necessary adjustment to address gap and challenges to achieve the set goal and objective. Epidemiological and operational indicator will be used to evaluate the program. The accomplishment for each individual strategy and activities measured against the set target enumerated or listed in National Leprosy Strategy. Measuring progress, high level impact indicator. Number of municipality with 0 leprosy cases, 0 new child autochthonous cases over consecutive 5-year period. Baseline 65. 2022 milestone 188, target 2025 377. Number of annual new leprosy cases disaggregated by age and sex 3282 to 3118 to 2462. Rate of new leprosy cases with grade 2 disability per million population 5.3 less than 2 less than 1. Rate of new child leprosy cases per million child population 30 less than 89 less than 6. Key indicator. Strategic pillar key indicator. Implement the National Leprosy Roadmap for zero leprosy across all levels. Political commitment. Development of National Leprosy Strategy and costed National Leprosy Action Plan. Establish national partnership at various levels for zero leprosy, incorporating government, deployment partner and person affected by leprosy at various levels. Increasing share of leprosy budget financed by domestic sources at all levels. Partnership. Implementation of integrated multi-stakeholder zero leprosy roadmap and national action plan. Inclusion of person affected by leprosy in planning and implementation of leprosy program. Capacity building. Development of a standard leprosy training manual, availability of leprosy training manual in each health facility, availability of at least one trained health staff in each health facility at high burden district, strategy in operation to build and sustain leprosy capacity among health staff, improve program management, surveillance and monitoring and evaluation system, availability of MDT and other logistics without major interruption, periodic leprosy review and evaluation conducted at various levels, availability of web-based case-based reporting system allowing disaggregation by age, sex, place of residence and other relevant criteria. Research. Budget allocated for operational research. Number of operational research conducted annually. Scale of leprosy prevention alongside integrated active case detection is a pillar to contact tracing. Proportion of contact traced and screened among new cases. Average number of contact screened per index cases. Preventive chemotherapy scaled up. Proportion of screened contact who receive preventive chemotherapy. Active case finding program in target population. Strategic pillar 3. Key indicator. Strategic pillar 3. Manage leprosy and its complication and prevent new disability. Early case detection, diagnosis and treatment. Number of proportion of new cases with grade 2 disability at the time of diagnosis. Number of and proportion of new autochthonous child cases and number of new cases with grade 2 disability. Number and proportion of multibacillary cases among new cases. Number and proportion of female cases among new cases. Number of relapses. Number of retreatment other than relapses. MDT complication rate, MB cases, bacillary cases. Number of new non-autochthonous foreign cases. Access of referral facility. Establishment designation of at least one referral health facility for management of complication in all the province and high burden district. Estimation designation of at least one referral health facility for constructive surgery in each province. Province Proportion of patients having access to referral services for diagnosis, treatment, management and complication and reconstructive surgery. Management of leprosy reaction, neuritis and disabilities. Number of patients with worsening of disability grade during and after MDT treatment. Number of patients in need of assistive device. Self-care. Proportion of patients given self-care counseling and information. Self-care group implementing disability care activities. Number of patients that need hospitalization for ulcer care. Mental well-being. Availability of psychological support at point of care. Availability of therapeutic counseling and mental health referral services. Referral services to address mental health need. Monitoring of antimicrobial resistance and adverse drug reaction. System in place to test for possible drug resistance and report on adverse drug reaction. Strategic pillar 4. Combat stigma and ensure human rights are respected. First, adoption of principle and guideline for elimination of discrimination against person affected by leprosy and their family member. Availability of guideline in local language. Inclusion of organization and network of person affected by leprosy. Participation of organization and network per person affected by leprosy in all important leprosy related activities. Inclusion of leprosy affected person in relevant leprosy position whenever applicable. Discriminatory law. Absence of legislation or regulation allowing discrimination on the basis of leprosy. Stigma reduction. Establishment of national hotline for reporting of stigma and discrimination against leprosy. Number of reported cases of stigma and discrimination against leprosy. Existence of national or province association of persons affected by leprosy for self-help and advocacy. Social support and rehabilitation. Formation of functional self-help group. Number of leprosy affected persons with grade 2 disability provided with assistive device. Provision of at least one rehabilitation center in each province for long-term rehabilitation support. We can see National Leprosy Action Plan 2021 to 2025. Political commitment. First, it is based on pillar 1. Implement integrated country owned zero leprosy roadmap in all endemic country. First, political commitment. Second, partnership for zero leprosy roadmap at federal, province and local level. Third, capacity building. Fourth, surveillance and data management. Fifth, research and innovation. Pillar 2, scale of leprosy prevention alongside integrated active leprosy case detection. First, contact tracing. Second, preventive chemotherapy scale up. Third, active case finding. Pillar 3, manage leprosy and its complication and prevent new disability. Early detection, diagnosis and treatment. Access to referral facility. Management of neuritis reaction and disabilities. 4, monitoring of antimicrobial resistance and adverse drug reaction. 5, self-care. 6, mental well-being. Pillar 4, combat stigma and ensure human rights are respected. Adoption of principle and guideline. 2, inclusion of person affected by leprosy and their family. 3, discriminatory law. 4, stigma reduction. 5, social support and rehabilitation. National roadmap for zero leprosy, target and milestone. You can see mapping of district municipality including human resource updated. Number of municipality with zero new child altocanthonous case over consecutive 5-year period. 743/753 from 605 among 753 municipality. Number of municipality with zero leprosy cases 65 to 565. Number of annual new leprosy cases reduced to 3,282 to 985, 70% reduction from baseline. Rate of new leprosy cases with grade 2 disability per million population 5.3 to 0. New child leprosy case detection rate 30 to less than 1. Number of child cases among new leprosy cases reduced to 260 to 10. 1% child case proportion among the new leprosy cases by the 2030. Number of child grade 2 disability among new child leprosy cases, 2 of 260 new child cases to 0. Discriminatory law exists. 2. Zero discrimination is a result of no discriminatory law and no discriminatory practice. Rollout of preventive chemoprophylaxis. 85% coverage among eligible contacts. Household contact examination of an index case within 3 months of case detection. 100% of index cases. This is the end of National Leprosy Strategy 2021 to 25, which is the latest National Leprosy Strategy. Government are planning their work based on this strategy. Thank you so much, everyone.